When performing this procedure, you want to make sure that the patient is properly positioned. I like to have the patient's head in a stable position to minimize patient movement. I feel a really easy way to do this is to have them in the seated position and to cross their hands on a surface in front of them and then place their forehead on their hands. If you see, this gives you good access to the occiput and the patient's head is stable. So I'm going to perform the OcciGuide procedure now. I have the OcciGuide. I'm placing it on the patient's head. I find the occipital protuberance and I place the logo over that. At this point, I want to clean the injection ports. And then I also want to clean the pathway of the nerves. I call this the upside down V. I go from the mastoid process to the occipital protuberance, and I clean the pathway. So occipital protuberance is here. This patient has hair, and this device works even with patients who do have hair. You just have to line this up with the anatomical markers. At this point, we bring the marker of the junction of the deformable metal arm and the elastic band down to one mastoid process. We bring the other marker down to the other mastoid process. If you notice, I'm moving the deformable metal arm in the middle. I'm not interacting with the elastic band. At this point, it's ready for injection. You want to advance the needle through the injection port, directing the needle slightly upwards, get down to the bone, withdraw a little bit, and then inject. And you want to follow suit at each one of these ports. So if you've noticed, this entire procedure occurs on the occiput, the back of the head, and at no point is any part of the procedure done on the cervical spine. If you find yourself in the cervical spine while performing this procedure, please stop and reassess how you're doing it because, again, this whole procedure should occur on the occiput. Once you're done, discard the needle. And that's the occipital nerve block using the OcciGuide. Are you doing okay?
Yes, great.
At this point, you delicately remove the headband, you discard it, and that's it. Thank you so much for watching this video and learning more about the OcciGuide. If you have any questions, please contact us at www.occiguide.com. Thank you.